Next we cover iodine and iodide. Iodine and iodide is absolutely essential to make the thyroid function. It converts T4 into T3 and frees it up for intercellular use. That is free T3. Iodide out of the food sources is the only thing that can do this. It is also the major thing for preventing breast cancer, breast lumps, ovarian cysts, and uterine fibroids, and prostrate in men. So iodide is very, very important. You got to make sure that they have enough iodide, because if you give them medication, you've got to make sure that the thyroid is working. Okay, so if they've had fibrocystic breast or breast lumps or lumps, you put a score in. Next, you look at their neck. These are the two bands around the neck that go from ear to ear, around the neck. And it's not age related, and you can see them going around. And then you can rate those on 1, 2, or 3. Slower speech, quite often people know that their speech slows down. You get them to poke their tongue out, the enlarged tongue. This is where the tongue presses against the teeth. When they poke their tongue out, the teeth leave scallop marks along the side of the tongue. That's not supposed to happen. And you look at the tongue sideways to see if it's slightly thicker, because iodine deficiency enlarges the tongue. Once again, puffy hands and puffy feet and puffy face, that's fairly easy to observe. You should have a score of 0 here. This person has a score of 8. Now we look at the iodine intake. The iodine comes from your food sources. Unfortunately, most of our food sources that we traditionally got iodine out of, this iodine has been depleted. So the government's decided to put iodine into salt, because that was a common thing that everyone used. Iodine is very, very important, but don't forget that salt, that is sodium chloride, bromide, and chloride and fluoride, are iodine inhibitors. In other words, they stop the uptake of the iodine. We prefer the patient actually to use rock salt or some other salt without iodine in, because it stops, or it helps with the stopping of the uptake of bromide. This person does not use salt with iodine added. Now we look at the number of times that they eat seafood per week. And here we see that salmon, tilapia, trout, and freshwater fish do not count. So this is seafood. That's ocean-going fish and shellfish. This person has once a week, and that is miles too low. You're going to have it at least 5 to 6 days a week. And this is based on the Japanese studies. The average iodine intake was about 13.3 milligrams per day. The score here should be 6, and of course this person's scores are 1. So they're totally reversed between the symptoms and their intake. Therefore, this person would need to be dosed with iodine.